Now, in this lecture, we are going to discuss topics related to dental management. So, what is dental management? Certain systemic diseases such as hypertension, diabetes mellitus, thyrotoxicosis, renal failure may complicate dental operation, such as tooth extraction, or tooth extraction may complicate the patient's condition. So, in dental management means that we want to avoid complication or medical complication that may occur during tooth extraction because these systemic conditions may complicate the tooth extraction or sometimes tooth extraction may complicate the systemic condition. So for example, if the patient's hypertension or with hypertension. So in this case, if we are going to do tooth extraction, the patient might have bleeding. At the same time, tooth extraction may cause pain, and this pain may lead to medical problems such as myocardial infarction or angina pectoris, and so on. So, in dental management, how we can manage the patient with certain systemic disease to prevent medical complication or certain complication occur during tooth extraction or any dental procedure. Let us start with the hypertension. By definition, hypertension means sustained elevation in the arterial blood pressure. So there are two types of blood pressure, venous and arterial. Hypertension means sustained elevation in the arterial blood pressure. The normal blood pressure measurement should be less than 120, which is systolic blood pressure, over less than 80, which is diastolic blood pressure, millimeter Hg. If the systolic blood pressure or the blood pressure measurement of the systolic blood pressure ranged from 120 to 139 and the diastolic blood pressure from 80 to 89 millimeter Hg. In this case, the condition is termed pre-hypertension or the patient in the state of pre-hypertension. That means this patient is more susceptible to develop hypertension in the future. If the measurement of the blood pressure result in 140 or more over 90 or more millimeter Hg, in this case the patient can be described as hypertensive patient or the blood pressure is elevated or hypertension. There are two types of hypertension, primary or essential, which is of unknown cause and represent the majority of hypertension cases. That means the majority of the cases of hypertension is essential, which is of unknown cause. It represents about 95% of the cases of hypertension. Secondary hypertension or secondary type, that means hypertension occurs secondary to certain systemic conditions or other conditions, such as patient with thyrotoxicosis or renal failure or certain endocrine tumors such as pheochromocytoma. So hypertension may occur secondary to these diseases. White coat hypertension, it is a descriptive term in which the patient may develop hypertension due to fear and anxiety of the white coat of the physician. So if we are not going to treat patient with hypertension or not going to treat hypertension, in this case, this will lead to certain complication. This complication affecting or this complication arising in certain vital organs such as heart, brain, eyes, kidneys, and so on. So the patient may develop ischemic heart disease, which is angina pectoris, and also myocardial infarction affecting the heart. The patient may develop cerebrovascular accident or stroke affecting the brain, or other organs such as eyes may be affected by hypertension and kidneys or even the brain. Regarding dentistry, this may affect also or may complicate tooth extraction. So if the patient hypertensive, in this case during tooth extraction, the patient may develop bleeding. And also the patient may develop angina pectoris, which is severe chest pain, and even myocardial infarction. This is complication during tooth extraction. In addition to that, certain antihypertensive drugs may interact with certain drugs that are prescribed by the dentist. For example, antifungal, non-steroidal anti-inflammatory drugs, or even conscious sedation. There is interaction between these drugs and medication used for treatment of hypertension. Although hypertension sometimes described as silent killers or silent killer, sometimes the patient may present with certain signs and symptoms. For example, the patient may have headache, weakness, dizziness, ringers in ears, and also retinal hemorrhage. Medical treatment, actually, this is the responsibility of physician. It is not the responsibility of dentist. So the physician may prescribe drugs such as beta blockers, angiotensin converting enzyme inhibitors, calcium channel blockers, or diuretics. Sometimes the physician may use more than one line, more than one drug. So may combine beta blockers with calcium channel blockers or even with diuretics. The most important things for us here, how we can manage with hypertension, how we can prevent complication or avoid complication that may arise during tooth extraction. So the diagnosed patient that means the patient who is already diagnosed, he or she knows herself or himself that he has hypertension or the patient with hypertension. This can be detected through history taking, patient's medication, and from the sign and symptom mentioned previously. Blood pressure of any patient of 40 years or above should be checked. We have to check blood pressure of any patient with 40 or above during dental appointment. Patient with elevated blood pressure more than 140 or more than 90 millimeter Hg should be referred, should be sent to a physician for medical management. Medical management, that means to prescribe drugs, antihypertensive drugs. Ask about medications, the antihypertensive drugs, and be familiar with these drugs. Why? Because certain of these medications might have a side effect, and this may complicate dental procedure. Establish an honest relationship with patient. The dentist should be honest with patient. Short morning and stressful appointment. Short appointment to reduce fear and anxiety or stress and anxiety. Morning because the level of cortisol is high, so the patient can withstand surgical trauma. All of these might help to reduce medical complications mentioned previously, angina pectoris, myocardial infarction, and so on. An anti-anxiety protocol can be used. And anti-anxiety drugs, for example, benzodiazepam, Valium, can be given to the patient before dental appointment or night before dental appointment. For example, 2 milligram or 5 milligram benzodiazepine, which is drug used to reduce anxiety, can be given to patient. Regarding anesthesia, we can use plain anesthesia without vasoconstrictor or anesthesia with low adrenaline concentration, 1 to 100 to thousands, and 2% lidocaine and 1 to 2 cartridges. Actually, the maximum number of cartridge or cartridges used for patients with hypertension should be no more than 2 cartridges. Avoid using gingival traction cord because it contains vasoconstrictor, and this might have been resolved through the gingiva and cause elevation in the blood pressure or hypertension. Change dental chair position gradually. As I mentioned before, certain antihypertensive drugs might have side effects such as postural hypotension. So in order to avoid postural hypotension, we have to change dental chair position gradually. Certain drugs, I mean antihypertensive drugs, might cause gag reflex, and we have to avoid stimulating gag reflex during dental procedure. Actually, this is not only to avoid or gag reflex not just arises from side effect as a side effect from antihypertensive drug, but also this may cause elevation in the blood pressure. So we have to avoid stimulating gag reflex for the patient when we treat patient with hypertension. So this is actually the dental management of hypertensive patient, how we can prevent complication during tooth extraction or any dental procedure for patients with hypertension. Thank you for your attention. This is the end of the lecture, and thank you for your attention.